the Arima dial would have spun in excess of 24 million times since the promise 45 years ago of this historic groundbreaking moment.
This hospital here, so long in coming, is going to be developed as a specialist learning institution with obstetrics, pediatrics, orthopedics, neurosurgery, general surgery, same-day surgery centers, as well as I could keep calling.
The 150-bed facility is being constructed by the China Railway Construction Corporation on behalf of UDICOT, whose line minister, Dr. Rudal Munilal, said the intent of the government is to take the health sector to the next level of cutting-edge patient care and services.
The hospital is being built to stringent North American and internationally recognized codes and standards, including the relevant health code seismic resistance.
Parliamentary Representative Roger Samuel added a philosophical twist to the proceedings by saying that there is, for Arimians, an emotional attachment to the struggle for a hospital.
This planned construction, this planned facility would bear on its shoulders the long history of the struggles and the pains and the sufferings of the constituents of Arima, the struggles of the people who had been crying out for so long and who we felt that we were neglected for so long. We now realize that there is a government that cares and cares for all of the people of Trinidad and Tobago.
Process and procedure, accountability and transparency are reasons why, said the Prime Minister, that the hospital comes almost at the end of her first term in office, but very much a part of much-needed healthcare reform and righting rural neglect.
As we move to secure your health and well-being, we also bring in care closer to communities and to the people who want a system that you can rely on whenever the need comes. This is how my government has managed since 2010. Determined action, supported by listening and consultation. And it is in this way that as a people and a nation, we will grow stronger together.
Speaking through an interpreter, the Chinese ambassador anticipates great relief for those who will use the hospital.
People in Arima no longer need to go to Port of Spain or San Fernando for seeing a doctor. Instead, they can conveniently come to Arima Hospital and enjoy its favorable conditions.
Needless to say, all those polled after the sod turning expressed gratitude and justification for the state-of-the-art facility.
It is the fulfillment of that elusive dream that Arimians had.
Only until I lost my son, I realized how important it was for us here in Arima and environs for us to have the best medical care for the type of services we offer throughout the area.
A hospital in Arima means life or death for some people. Life or death. Remember, a few seconds is the difference between life or death for a patient.
For the Honourable Minister, a moment of absolute joy, both as a servant of the people and a doctor by profession.
Notwithstanding that I'm the Minister of Health, but I'm also a medical doctor. And I do feel a tremendous sense of emotion that the people of Arima will be getting their hospital after 4.5 decades of failed promises.